Find answers. I'll bet every one of you knows somebody who has had cancer, hopefully not in your family, but maybe in your family, and a treatment was prescribed, and for another person who had the same cancer, treatment was prescribed, and it worked on one and not the other. Why? Why does that happen? Well, there are answers, and the only way to...
Hi, my name is Larry Wiesenthal. I'm a medical oncologist, which is basically a cancer chemotherapy doctor, and I live and work in Huntington Beach, California. There are currently almost 200 drugs approved by the FDA for treating cancer. As Joe Biden, Vice President Biden, just explained, it's a problem in that drugs which may work very well in one patient don't work at all in another patient with what seems to be the identical disease. And there are many, many cases of patients, they get treated with one type of chemotherapy and it doesn't work. And so they get switched to a second type of chemotherapy called second-line chemotherapy. And that works very well. Or maybe it's not until they pick the third-line therapy. But the problem is that you only get one chance at first-line chemotherapy. First-line chemotherapy is when you've got the best chance of getting the best result, and you certainly have the best chance of treating the disease. So it's really important to pick the best treatment the first time. But the point is that you'd like to get the very best treatment for your individual disease whenever you're treated, and preferably the first time. And what I'm going to be doing in the next few segments, I'm going to try to be making a series of videos. Bear with me, I am certainly not a professional videographer. I'm no good at screenwriting. I'm not a particularly good talking head. But the whole field is very interesting. And by that I mean the field of how you select treatment for individual patients. And this is normally done these days by different types of laboratory tests. And I'm going to be taking you through how these laboratory tests work, how they work well, and how they don't work so well. And it's a very interesting topic. It's got a real interesting history, and I look forward to sharing the history and what I have learned in my career of studying these various types of technologies and kind of tell you where we are today and what promise there may be for the future. But the whole idea is to pick the best possible treatment for each individual patient, and that's what we're going to be talking about.